Ronald Nyakweba. I'm the CC for Medical Services, Public Health and Sanitation, Kisii County Government. Epilepsy cases in Kisii, and find out what are the possible gaps that we need to look at as we wage the war against this disease, which of course in our communities most people have taken it as a curse, but we know this is one disease that is treatable, that can be treated because there is a cure that is available for the disease. What is lacking among our people is information, and awareness needs to be created so that our people who are kept in the houses, the patients who are kept in the houses, can be taken to hospital for treatment. We've been in discussion with the KAWE together with other partners, that is Manage and Area, to establish a clinic in Kisii, which clinic will basically be handling epilepsy cases for the epilepsy patients in Kisii.
Doing this from the framework of IGAP. IGAP is Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders that was ratified by WHO in the year 2022. It's a 10-year action plan that talks about 90% of the people need to be reached and know about epilepsy, that 80% need to access treatment, because we have a treatment gap of 80% in Kenya especially and across Africa. So that means out of 10 people, only 2 people are able to access healthcare facility. And out of that, the other aspect of the action plan is 70%, that these people need to regain meaningful control through medication, and so that they can lead their lives to full potential.
Kenny David, I'm the County Cancers and NCD Coordinator, and I'm the Principal Investigator for this baseline survey that was conducted towards the end of last year. And basically, as the survey, the objective was to look at knowledge, attitude and perception of the people of Kisii County. And this is one of its kind survey that has been done around people who have epilepsy in the country, and very few studies have even been done globally. And this is an opportunity for us to understand how differentiated the misconceptions are, the attitudes, the stigma around the county, which will dictate on the strategies we'll have to put in place to ensure that we improve the care of patients who have epilepsy.
The clinic will be constructed in partnership with KAWE, Kisii County Government and Manage and Area Foundation. It will be equipped with modern equipment, which will go a long way in addressing this particular disease and many others that people are suffering from. This is going to be a game changer insofar as the war against this particular disease is concerned.
So the point of helping us understand which sub-county is more affected, and how we can put down targeted interventions to ensure that we get quality of care to these patients, and also reduce stigma within the community. And also looking at even the demographics of that baseline survey, it has also shown that there's discrimination also in women. If women the question is if women have the opportunity to reduce stigma within the community. The answer is they are more disadvantaged because of the cultural issues, and we have men are the ones who can speak out and people listen, contrary to women. So all these aspects are what we are discussing to ensure that strategies will be put which are targeted and more